Unnecessary breast and genital exams for sports physicals, presented by Medical Patient Modesty. We are going to be discussing why breast and genital exams are unnecessary for sports physicals and what exams are necessary for them. Sports physicals, also known as pre-participation physical examinations, are required at most public and private schools in the United States for students wishing to participate in sports on an annual or seasonal basis. The purpose of sports physicals is to determine if a student is healthy enough to participate in sports and to minimize the risks of sports-related injuries. This exam is designed to identify any high-risk disorder or condition such as heart disease, diabetes, sickle cell trait, and asthma that might affect an athlete's ability to play. Many athletes with health problems are still able to participate in sports. For example, if an athlete has frequent asthma attacks, the doctor might be able to prescribe a different type of inhaler or adjust the dosage such that the athlete can breathe easier when she or he runs. While there is no absolute standards about what should be included in sports physicals, most people agree that they should have a heavy emphasis on cardiovascular and musculoskeletal systems. Heart disease is the leading cause of athlete deaths. One athlete's doctor discovered that he had a defective aortic heart valve during a physical exam. He was told he would die within a year if he did not have surgery to repair the valve. He is doing well now and runs in marathons. This case proves how important a cardiac exam is for sports physicals. Dr. Sherman shares this information in his article, quote, "The manner in which the exams are done is also not standardized. Most schools will give students an option to see their private physician to have a form filled out. The private physician may elect to combine this with an annual exam. Schools will usually offer a group examination, which varies greatly in terms of how it is set up. It could be one physician or nurse practitioner seeing the students one at a time. It could include multiple specialists seeing the students at different stations in a large area, such as a gymnasium. It often includes no provision for privacy." There are two components of the sports physical, and they include medical history and physical exam. Most athletes and their parents will be asked to fill out a medical history form before the physical exam takes place. The medical history is an important tool in identifying health problems that might affect an athlete's ability to participate and or perform in sports. After the medical history form has been filled out, every student should have a physical exam that includes an evaluation of heart. This is done to look for irregular heartbeat or heart murmur, lungs, blood pressure, weight and height, vision, blood test, musculoskeletal to evaluate posture, joints, strength, and flexibility. Specific sports such as wrestling may require additional exams such as skin exams to make sure the athlete does not have a contagious skin disease. Why are sports physicals often embarrassing for boys? Many boys find sports physicals embarrassing because many doctors still require boys to have genital hernia exams to be cleared to play sports. Even some boys have refused to participate in sports because of those exams. Here are some facts about genital hernia exams. Many sports physical forms have a box that says genitalia-hernia male, or genitalia, genitourinary exam, genitourinary system, or testicular exam. The hernia genital exam is considered standard for sports physicals by some guidelines. The hernia genital exam is considered standard for sports physicals by some physicians as well. How can you quo? If you are a patient, then deny consent to having your child subjected to a genital exam or hernia check. If you are a student, tell your parents that you want to check yourself for any hernia or genital problem rather than have some strange doctor do it. We are going to discuss reasons why boys are embarrassed about having genital hernia exams. Dr. Sherman shared that he has seen female physicians blogging about how embarrassed boys get during those exams, and that this problem is rarely addressed in this article. Another problem is that male doctors often have female nurses as chaperones for male genital exams, and that makes the embarrassment much worse. Reducing the embarrassment can be addressed in many ways. For most boys, a male physician is less embarrassing than a woman. But women, who are a majority of pediatricians nowadays, are often the ones who perform these exams. Increasing preference is given to female gynecologists for adolescent girls' exams. The same preference should be granted to boys. That's taken from the article Sports Physicals, Are They Needlessly Embarrassing? By Dr. Joel Sherman. Many boys still find genital exams embarrassing, even doctors, without any women being present. Some male doctors have humiliated boys. One male doctor blogged using terms such as hilarious, entertaining, and quite funny to describe the embarrassment and humiliation felt by his young male patient during the hernia exam. This, after commenting extensively about the fact that he knew the exam was unnecessary and that as a doctor he had the opinion to omit it but chose not to. He talked about how he had to make a boy pull down his pants and underwear. When the boy told the doctor that he was not going to pull down his pants for the hernia check, the doctor responded by saying, quote, "If you do not do this, you cannot participate in sports." The boy reluctantly pulled down his pants half an inch, showing the band of his underwear. Then the doctor told him to pull down his pants and underwear all the way. Why genital hernia exams are unnecessary for sports physicals. Dr. Joel Sherman, a cardiologist who wrote the article Sports Physicals, Are They Needlessly Embarrassing?, shared this information in his article. The reason for this is unclear, and the need for a genital and hernia exam is undocumented. Though some information as to the child's development can be obtained by a genital exam, the exam is usually not pertinent to the ability to play sports safely. It is doubtful that asymptomatic hernias affect one's ability to safely play sports. A good history should detect who needs to be examined for this. Indeed, it is clearly recognized that the need for a genital hernia exam is controversial. There are no clinical outcome studies available which document the need for these exams. Informed patient consent is often missing from genital hernia exams. Parents and boys are often not told the truth that there is no need for genital exams to ensure that they can play sports safely, or asked if they wanted them done. Dr. Sherman shares this important information in his article. Hernia exams should only be done when the history indicates a possible problem. The NCAA 2008-2009 Sports Manual doesn't even mention the word hernia. There is no other need for genital exams to play sports. Given the total lack of evidence that routine intimate exams add to the safety of participants, the regular use of these exams should be abandoned. Genital exams are not necessary for sports physicals, since there is no evidence that they ensure the safety of playing sports. Adolescent boys should be taught to self-examine for testicular lumps and hernias, and if they have a problem, they can always go see a doctor. Kids will know if they have a hernia if it is significant. If it is too small for them to notice, nothing need be done unless they are having some pain. Small hernias can usually be left alone. Parents need to ask how a forced genital exposure shows a readiness to play school sports and how this type of treatment affects boys emotionally and psychologically. Parents should be prepared to advocate against unnecessary exams for their children. Why sports physicals can be embarrassing for girls too. Most doctors do genital exams on girls for sports physicals, so girls are less likely to have embarrassing sports physicals than boys. In one community, a well-respected male doctor took advantage of some girls by conducting private breast exams during the sports physicals without parents' knowledge or presence. Many girls were very upset afterwards, as the exams were unexpected and they did not know why it was done. Any doctor, especially male, should be reported to the state medical board and to the school for sexual misconduct if he performs breast, genital, or pelvic exams on girls during a sports physical. There is no reason for breast, genital, and pelvic exams to be done on girls for sports physicals, since they have nothing to do with ensuring the safety of girls playing sports. The sports physical form for Colorado has an option for pelvic exam, and this should be removed. Here are ways we can end unnecessary intimate exams for sports physicals. Number 1. Educate parents, coaches, and teachers about unnecessary intimate exams for sports physicals. 2. Parents should lodge complaints with schools when unnecessary intimate exams happen during sports physicals. 3. It is always prudent for a parent to be present for his or her child's sports physical exam so he or she can help to advocate for their child that no intimate exams happen. Next, encourage doctors and nurses to end unnecessary intimate exams for sports physicals. Teach children that they should refuse genital breast exams for sports physicals and to not take off their underwear if asked to do so. Parents should fill out as much of the form in advance, including marking no consent on portions of the exam with which they are not comfortable. Doctors have the liberty to customize those exams per their judgment, thus not everything listed has to be done. Parents should consider bringing a letter stating that the doctor cannot do a breast or genital exam on their child. We use the following sources for our presentation. The article, Are Breast and Genital Exams Necessary for Sports Physicals? From Medical Patient Modesty's website. Sports physicals, Are They Needlessly Embarrassing? An article that a cardiologist, Dr. Joel Sherman, wrote on his blog about patient privacy and modesty concerns. Please share this with family, friends, and other people to educate them about unnecessary intimate exams for sports physicals. We need to raise awareness that there is no evidence that breast and genital exams help athletes to play sports safely. If you have any questions, please email Medical Patient Modesty at info@patientmodesty.org.